All right, thank you for joining us tonight for another episode of State of the Virus. And today we're joined once again by Dr. Michael Scalzone from Guthrie. Thank you for joining us today, Doctor.
Happy to be here, George.
All right, so Doctor, right now it kind of feels like we're in a fourth wave of the virus here in the Twin Tiers. What are you guys seeing in the hospital over at Guthrie?
We're certainly seeing that same thing. So if we look at positive rates in the community, they certainly have been rising over the course of the last 2 to 3 weeks. And we're also seeing more patients hospitalized in the last 2 to 3 weeks. So a very different situation than January and February, where we saw, a very happy to see drop in cases.
All right, and I know one day Steuben County reported that a majority of their cases that day were in younger people. Is that something that you're seeing, and are these younger people becoming hospitalized?
So the cases do seem to be in younger people. And as we look back over the course of the last few months, we've seen that slowly changing. So we've seen slowly that more and more of the younger people are getting the infections rather than the older population. That's probably in part because of vaccination of that older population, and it's partly in part just behaviors in the community. What we are seeing is that still mostly the elderly and those with medical conditions that are requiring hospitalization.
So with younger people starting to get the virus, are we seeing more people now that everyone is eligible for the vaccine? Are younger people signing up for the vaccine right now?
Not in the numbers we'd like to see. As most of your viewers probably know, unfortunately, there are vaccine appointments that are going unused. These used to fill rapidly within minutes, and now we'll have days where only about half of our available appointments will be filled. So even as we expand to a younger population who are eligible now, we're not filling those appointments.
All right, one issue that has come up now is the Johnson & Johnson vaccine. Last week, the governor announced that there was going to be fewer vaccines coming in because of an issue with the manufacturing. And now we're finding out that there is a potential blood clot issue, similar, I guess, to the AstraZeneca vaccine. So what do we know about the Johnson & Johnson vaccine, both with the distribution and now with these pretty rare blood clot issues?
So the distribution, I think, is exactly what you said. There was a manufacturing issue, but I'd like to put it in context a little bit. So far, we have given, as a nation, 7 million J&J vaccines, and we've given 180 million vaccine doses in total. So it remains a very small piece of the vaccination pie, if you will. So the vast majority of people who have been vaccinated have received either the Pfizer or the Moderna. As far as what we're seeing from the clots, this is a rare complication. So it seems that we've found 6 cases across the country, again, in those 7 million individuals, of an unusual type of blood clot. And because it is specific to a group of individuals, typically these 6 patients have been women between the ages of 18 and 48, and they've had a specific type of blood clot associated with low platelet counts. And that's what's made it unique. And that's why they've put a pause on to see if they can study this a little further and decide if it really is a causal from the vaccine or whether it's just a coincidence.
And we talk about this is literally a 1 in a million case, it seems like, for the people that are having these issues. So how much concern should there be for people who have received the J&J vaccine? And should those people be looking out for any kind of symptoms? What should happen if you did receive the J&J vaccine?
So I think you're absolutely right. It is very rare. So we're looking at less than 1 in a million individuals who have had this condition. Secondly, if it's been more than 3 weeks since you received the vaccine, then you can rest assured that it's unlikely that any kind of a complication is going to happen. And if you feel well, if you're not having a severe headache, if you're not having abdominal pain or shortness of breath, you don't need to seek care right away. However, if you've had that vaccine within the last couple of weeks and you have a severe headache, severe abdominal pain, or shortness of breath, you should see a healthcare provider immediately.
All right. Going back to some of the other vaccines that we have right now, the Pfizer and the Moderna, again, it seems like those rollouts are going very well. What are you seeing in terms of the Pfizer and the Moderna and how people are feeling once they get those shots?
Yeah, things seem to be going very well. They'll have the normal side effects after a vaccine, soreness, perhaps a small headache, or some fatigue, but no significant side effects. The safety profile seems very good for both of those 2 vaccines. It's really a matter of making sure it's available for enough people and getting them to come in and get the appointments.
All right, so I know I got the Johnson & Johnson vaccine. After I got it, I felt completely fine. My arm wasn't sore. But once I went to bed, I had a fever. I was up all night. Um, and I was thinking, am I able to take Advil or Tylenol or something like that? And I know a lot of people have had these questions. Do I take it before I get my shot to prevent anything? When can I take it? So what do we know about taking these medications after receiving or even before receiving your COVID-19 vaccine?
So those type of medications can impact theoretically your body's immune response. So the current recommendation is to not take them before the immunization. So don't take it before you get vaccinated so that you don't blunt that immune response. If you start feeling poorly 4, 6, 12 hours later, it's absolutely safe and fine to go ahead and use Tylenol or ibuprofen or some other fever reducing medication like that.
That's good. I took Advil and I was fine after that. So also Pfizer coming out with some information about vaccinating children. I know this is another topic that a lot of people care about. Talking specifically about the 12 to 15-year-olds. What do we know now about that data when it comes to the Pfizer vaccine?
So it is early data, but it is reassuring. So the data that they're seeing from ages 12 to 16 looks like a similar side effect profile and safety profile for those of 16 and above. It's only about 10,000 individuals right now and only for a few months, less than 6 months. But everything that we've learned about the Pfizer vaccine up to now in adults seems to be following on the same way for those younger patients. And hopefully we'll be able to offer vaccine to those individuals soon.
And I know that with the Pfizer vaccine, 16, 17-year-olds are able to get. Are we seeing parents sign up to get the vaccine for their kids, or is that also something where we just need more information to remind people that these vaccines are safe?
No, we're seeing people who'd like that vaccine. Absolutely. We're seeing parents come in with their children to get that vaccine. And that's reassuring to us. Again, the younger people are those that are out in the community. We're seeing higher rates of infection in those teenagers and young adults. And that's the population we'd like to get vaccinated.
All right. So now that I am vaccinated and millions of other people are vaccinated, what are we able to do? And what do you as a doctor feel comfortable doing once you're fully vaccinated, once you've hit those 2 weeks of protection?
So if you're fully vaccinated and in your group of other people who are fully vaccinated, you really do have a little bit of freedom then. You can take off your mask, you can get a little closer if you're in a group, a small group of fully vaccinated people. If you're in public and you don't know if others are vaccinated, or if you're in a larger group, unfortunately, we still need to wear masks at that point and still need to remain social distanced. What we're learning is that the current variants that are out in our community remain highly infectious. So those that are not vaccinated are becoming infected a little more easily than they were 6 months ago. We really do seem to think that this is an impact of the variant.
So are these different variants prevalent in our area now? We talked about, I think a couple weeks ago, one of the strains was detected in a neighboring county. So are we seeing more and more? Because I know we talked about the UK strain becoming potentially the dominant variant. Is that now the case here in our area?
Well, we don't have a lot of information about our actual labs here. If we look at the states around us and our state lab, it does seem to be that that is what's happening. The UK strain has become more dominant and it is clearly more infectious.
All right. So again, going back to what we're able to do once we can go out, is it kind of safe now once you are vaccinated to go out to a restaurant, or maybe, I know travel, they still don't want people to travel, but is it technically safe to travel or go and sit in a restaurant if you really need to?
So it's all about mitigating risk, George. Obviously nothing is going to be 100% safe and nothing is going to be completely with risk. And so what we want to do is we want to balance that. We want to help people be able to get back to whatever part of their normal life that they can, being smart. So one of the recommendations, if most people are vaccinated, but you have someone who may be unvaccinated and very vulnerable in your group, then you should still practice that social distancing. So it's really about trying to identify that balance, who that you might be around that could be at high risk for getting the disease. So that if you are out in public as a vaccinated person, recognize those around you may not be vaccinated and they could still be at risk. So for now, it's still balancing out.
All right, doctor. So again, we're unfortunately in kind of this fourth wave that we talked about, hopefully that we wouldn't see here. What are some of your final thoughts when it comes to the vaccine and just some more of these mitigations of, you we kind of have to go back to basics now at this point.
Yeah. So I do want to separate the J&J vaccine concerns from the other vaccines. The vast majority of the vaccines in our area are either the Pfizer or the Moderna, and their safety profile is well proven. So I don't want people to hesitate to get vaccinated because of this. We'll look deeper into this J&J vaccine issue, and we'll take more guidance from the states and from the CDC. But right now, our best bet on slowing down the infection is to get vaccinated.
All right, Dr. Michael Scalzone, thank you for joining us today. And viewers, if you have any questions regarding COVID-19, make sure to email us at news@wetmtv.com. Thank you for joining us and have a good night.